So the nice thing about having an implant go above or below, it really takes into consideration a couple of things. The first thing I really think about is how much breast tissue you have. And certainly if you're very thin and you have almost no breast tissue, you can put in an implant on top of the muscle. It may be pretty visible, and so you don't want to have a look that looks like, hey, I just stuck this implant on the outside of my skin because my natural tissue is so thin it can't camouflage it. And so certainly going underneath the muscle softens those contours. However, if you do have a fuller breast, then it may make more sense to go on top. You're disturbing that muscle much less. You're getting all the shape that you need, and you have plenty of tissue to camouflage that implant. Because the most important thing, we don't want to look fake, and we don't want everyone to know that we've had breast augmentation. And so we want to have a soft look. The other thing that can be an issue when going underneath the muscle is what we call pectoral animation, and that means the muscle moving over the implant. And that's going to be more visible with a smooth implant because it's slippery, so the muscle can move over top of that. With a textured implant, it's going to grip. You're still going to have a little bit of motion, but certainly not as severe. But if you're on top of the muscle, then you don't really see that because the muscle's actually behind the implant, and so you're not going to get that motion. And so there's many things that go into that, and so really you want to have a thorough conversation about what are you trying to achieve, what are the things that are going to bother you, what are things that are not going to bother you, so that you pick the implant that's going to give you the outcome you're looking for. One of the things we want to be thoughtful about is going on top of the muscle in capsular contracture, and that's the tightening up of the tissue around the implant. And capsular contracture can happen below the muscle or on top of the muscle. The thing that we do know is that if we are going on top of the muscle, we really do prefer to have a textured implant, because the research really has shown that a textured implant has a much less likelihood of capsular contracture, especially in the plane above the muscle as opposed to the plane below. So there's many variations to this, and so it's a conversation that we really want to have to determine how much tissue you have and what's going to give you the best look. So when we're looking at implant placement, the two people that I really am thinking about going on top of the muscle, that most people have a choice about, but the two people that I really am concerned and prefer to stay on top of the muscle are fitness competitors and women who may have a tuberous or constricted breast. And so each presents its own issues. In fitness competitors, they're very, very lean, and so you have to balance how much natural tissue that they have. But because they are working out so heavily and their muscles are large and they're very, very well defined, and especially when they compete, they are posing and they are flexing. So having a muscle that is moving around is very distracting, and it really detracts from their overall outcome of what they're trying to present when they're in show. And so for those women, I really strongly recommend going on top of the muscle. The other group of women are women who have a tuberous breast or a constricted breast. And really these are fibrous breasts that perhaps may not open up all the way and may not be as round as the average breast. They tend to be, we call it torpedo shaped, and more tubular shape. And so that tissue is very thick and dense, and so going on top of the muscle, it will help release and open that tissue up so that it can drape around the implant to actually give them more of a rounder shape compared to what they had prior to surgery. And so in those patients, in many cases, I do recommend going on top of the muscle as well.